evening to all who is tuned in on the radio and watching us live on our Facebook page, Qabayan FM 943. Welcome to the 5th episode of The Doctor is In, and tonight you are with Georgie. We will be joined in by an expert from Nasim Alrabeeh Dental Clinic, that is none other than Dr. Ali Hassan Sayed, to discuss orthodontic problems and solutions in the new era. Dr. Ali is a fellow College of Physicians and Surgeons in Pakistan, and he was also an associate professor and head of department in one of the prestigious dental colleges in Pakistan, with over 12 years experience in orthodontics and, of course, cumulative 15 years in the dental field. Good evening, Dr. Ali.
Good evening.
Thank you for joining us here on Qabayan Radio, and of course, you will be sharing your knowledge and your expertise on the topic for tonight, which is orthodontic problems and solutions of the new era. And I'm sure our listeners are looking forward to your insights on this very interesting topic.
Thank you so much for having me with you. Bismillahirrahmanirrahim. I am, as you can see, this is my first time in Doha.
Mm-hmm.
And just to have something, talk about my field, that is orthodontics. In layman terminology, it is braces.
Mm-hmm. Oh, yes.
So these are the few things like I need to discuss, and just to make the people aware of what are the orthodontic problems and what are the solutions in this field in the new era.
Okay.
So it's all about now orthodontics, so you can have any sort of queries or something like that.
Thank you. Thank you, Doctor. We do. You are absolutely right. We do have some list of questions, and we would like to begin. So let's get the ball rolling. Yeah. So our first question is, of course, you are a representative of the Alrabeeh Dental Centre. What are the most common teeth problems that the patient presents to you in the clinic? And this is located in Al Azizia, correct? Yes.
It is new Alrabeeh Dental Centre, situated in the Al Azizia. It's been like more than 1 year I've been working with this new Alrabeeh Dental Centre, Al Azizia.
Right.
So I have seen many of these malocclusions, irregular teeth.
Right.
Sorry. So a lot of there are presentations about the irregular teeth. Some they have the protruded teeth, they're forwardly placed teeth, and some they have the upper teeth under bite of the lower teeth.
Right.
So if you can say there is a mix and match cases in all, from all the classification of the malocclusion, that is irregularity in the teeth. So that most of the patients, they are from the irregular teeth, crooked teeth. They present to me.
Right. Are these most common with adults or children in your 15 years of experience? And I'm sure you've had patients with varying ages. Are these common in children or mostly?
Actually, let me clear this thing, that it is not a disease.
Yes.
It is just a developmental problem.
Right.
There are basically the problem. It is started from there is basically nature versus nurture. So some is from the genetic side, and some is the environmental side.
Exactly. Right.
So sometimes it is genetic, like the person or the boy or the girl might acquire teeth from the mother and the jaw from the father. So there is a tooth size, jaw size discrepancy.
Okay.
So it ends up in basically this irregular teeth, because the teeth cannot be accommodated in the small jaw.
Of course. Yes.
So this is the one part, that is genetic part. Now the second part is environmental. Environmental is basically nowadays, if you see, most of the children, they thrive on the junk foods.
Oh, okay.
They thrive on the junk food, so they don't have their jaw exercises, because they do not have the fibrous diet.
Right.
So if you compare the urban and the rural area children, you will see the rural area children, they will have a good teeth alignment, because they use this fibrous diet and everything.
Right.
But as far as the urban children are concerned, they always thrive on the junk food. That is a very soft, peppy food.
Right.
So the jaw does not get exercise. So that is the issue, that the jaw does not grow to accommodate all the teeth. So they may end up in the malocclusion or irregular teeth.
Right. Doctor, does it require for example, since we're talking about children, no? Does it require for children to be treated by a pediatric dentist or a general dental practitioner, or an orthodontist will be able to also provide the same care needed for kids?
Yeah. If you see the children, the kids, they usually present to the pediatric dentist. That is their domain. If they can, basically, if they see that they can manage,
right,
they are pretty sure that they can manage. So this is their domain.
Right.
But if it is out of their domain, they can refer it to the orthodontist,
okay.
because it's beyond the general dentist scope.
Okay.
So that is the only reason that they usually refer to the orthodontist, and we usually have a good liaison with the pediatric dentist.
Actually, it came as a surprise for me as well, that there are actually, I'm not sure what's the ratio of pediatric dentists. For example, probably in Pakistan, you'll be able to give us a ballpark figure, because it's the specialization, right? And you need further studies, if I'm not mistaken.
Yeah, sure.
Okay.
So basically, the pediatric, they are very less common.
Okay.
They are very less common, and the most probably there might be you can say, if you compare to the other fields of dentistry, they might be more or less common. But if you see the other part of the general dentist, they are also doing some short courses in the pediatric dentistry, although they don't have the fellowship and membership, but still they go for the short courses. So
to
they
be
have,
able to update,
So they have a lot of, because there is always continuing professional development.
Of course.
So they always do have this sense of referring the patient to the specialist, if this is out of their domain.
Okay, doctor, what are the basic requirements to start an orthodontic treatment?
Orthodontic treatment, actually, first of all, that is, first you present to the doctor. So before, it was like a parental attitude, like the doctor was the wholly and solely, he was there to decide each and everything regarding the patient treatment. But now there is a paradigm shift. So now there is always an input from the patient as well, because it is being done to the patient. So he or she has the full right to have an input regarding his or her treatment. So first of all, they present to you with the chief complaint.
Okay. What sort of complaints, doctor? Like
irregular teeth, crooked teeth, forwardly placed teeth, the bite do not close, and there is a pain, and also when they feel like they cannot be, this is a social stigma.
Yes, I was going to ask that. Yeah.
For some patients, this is a social stigma, especially in the females. So they always present to you with this chief complaint. There are a lot of complaints, but these are a few common that I'm just telling you, I'm just speaking about. Before that, I'm just to talk about the other requirements to start the orthodontic treatment. Let me clear it that basically there is no strict contraindication to any age group of this. There is no strict. Even you can, I have been seeing the patient more than 50 years of the age. Yeah. Until unless provided that they don't have any comorbids. Comorbid means that they are not hypertensive, they are not diabetic, they don't have any bone problem, they have a good set of teeth. So this is not a contraindication, so they can always present to us, and I have been treating more than 50 years of age patients.
So you're saying, doctor, if the patient has pre-existing conditions, like what sort of condition should they be? Diabetes.
Yeah, diabetes is the most problem, because in that the teeth, because that become more
yes,
mobile.
Of course.
And if they don't have any of the systemic cause that can affect the bone, so they can basically be an obstacle to your orthodontic treatment.
So obviously there will be like an X-ray or what do you call that procedure? It's like radiographs. Is that what it's called?
Now coming to the orthodontic requirements once again. So first of all, we have a general history, general examination, chief complaint. After that, then we can go for the orthodontic radiographs. That is, one is the lateral ceph, the other is OPG, orthopentogram. So in that we can assess the profile as well as the bone and on the clinical examination, the gum level and the gum condition. And as far as the radiographs are concerned, so we can also see Is there any discrepancy? Is there any bone disease? That can be an obstacle to the orthodontic treatment. So then afterward, we also go for intraoral and extraoral pictures photos for the patient, just to avoid the litigation, and also the patient can see before and after the results, so the patient can be get satisfied.
The progress, right?
The progress.
Since you mentioned that you've had or you've treated patients that are 50 years old, what do you think, or what age do you recommend for children to start or to consider going through a braces in this case?
Like there is a basically you have to you have to be very clear about it that if the kid has the problem with the bone, with the jaw, that is called growth modification.
Okay.
So we can start it earlier as 7 years of age.
Really?
Yeah.
Wow.
If there is a problem with the jaw, with the growth problem. As far as the teeth are concerned, if there is no jaw problem, we can start after the eruption of all the permanent teeth.
I was going to ask that, doctor.
After all the eruption of all permanent teeth, that is around 12 years of age.
12?
Yeah, 12 years old, that is the best age, because at that time the patient is also growing. So the growth also basically, it basically helps you to move the teeth quickly.
So just to clarify, doctor, you said from 7 years old, if the patient goes through an x-ray and checks the growth of the bone, and you see that it requires some treatment, you will proceed with the treatment braces at 7 years old, even though the permanent teeth has not fully erupted?
So this is what I want to clarify. Let's see, so for example, if the patient has the upper jaw deficient.
Right.
So this is the right age at the age of 7 years. We start with the face mask therapy. That is to promote the growth of the maxilla, just to bring it forward. That is the right and that is the good age, that is the best age if you can modify the growth. Now, this is concerned with the bone, with the jaw. As far as the teeth are concerned, that is the best age is 12 years. So basically, they do have the two phases treatment, two phases of the treatment. First is the growth modification, followed by the fixed orthodontic appliances. That is braces, you call the braces.
Okay. Are there any indication or contraindication for specific age groups?
As I have already mentioned, there is no strict, absolute contraindication is not there. But if you see that the bone response might be a little bit delayed as far as you are just having more ages. So this might be the only reason that can be the response of the teeth can be delayed as compared to 12 years or 13, 14 years, a young adolescents. So this is the only reason, provided that the patient does not have any of the comorbids, pre-existing conditions, any systemic causes.
Doctor, I just have a question. So you mentioned earlier, before this one, that you have treated patients older than 50, or I think the oldest is 50, right?
More than 50, yeah.
Wow, more than 50. So is it necessary that the patient has to have a complete set of teeth? Or there are only particular tooth that has to be present to be able to hold the braces? Because I know that, for example, the molars has to be there, if I'm correct, and then I don't know if it has to have a complete set.
Okay.
Because usually at the age of 50, some are ready.
So this is what I told you. So this is the prerequisite, the teeth should be there. The prerequisite is to move the teeth. No, it's not always necessary, because some patients, they do always come with the complaint that they have only the front teeth irregular. So we can have braces on the front teeth in order to make them corrected, aligned. But there is also another part of the orthodontic that is called adjunctive orthodontics. Adjunctive orthodontic is basically some patient, they have a crooked teeth. Some patient, they want to have any other dental procedures. So for that dental procedure, the teeth are crooked. So we can do the orthodontics before they go for the other dental procedure. That is called adjunctive orthodontics. So it is being done most probably around more than 40 years of age.
Okay. What are the most common procedures you are doing or is available at the new Alrabeeh Dental Centre in Azizia?
Till date, I'm doing all the procedure, almost all the procedures like fixed orthodontics, the braces, the growth modification appliances like face mask therapy, twin block for the growth modification, habit breaking appliances, mini screws I am doing.
Mini screws meaning?
The mini screws means like now this is an era of the new orthodontic technology, sometimes we need mini screws to have some set of specific movements. So for that reason, we need to have this mini screw. These are also called temporary anchorage devices, TADs. That is called TADs. Temporary anchorage devices. When we are finished with our movements, we just remove it and throw it. So we are also doing all the procedures. Almost, I'm doing for the ceramic brackets, ceramic braces. That is a tooth colored. I'm doing the metal braces. That is conventional braces. And also I'm doing the clear, that is also one of the brands. Eon,
is that the Invisalign?
Invisalign and
what is the difference between the lingual, is that the right term? Lingual braces, aligners, or Invisalign? Is that the right term, doctor?
No, Invisalign is basically, if you see, this is a trade name.
Right.
And it is for the clear, that the plastic braces.
It's plastic.
Plastic braces,
okay.
As far as the lingual orthodontics is concerned, the lingual orthodontics has a lot of, it's a very broad term. But if you are seeing just for the braces, as far as the braces is concerned, so it is one of the brand is Incognito. Incognito, these are most favored by those patients who are basically above 40 years of age. So they don't want to have their braces on.
Right,
so
and it's transparent.
So it is from the inside.
Okay.
So they don't want to have a show up of the braces.
Of course.
So for that reason, they always opt for the lingual orthodontics.
Okay. Does the treatment time vary because it's, transparent or it's plastic? What is more in terms of the length of the treatment?
Yeah, okay.
Is it quicker? What's the benefit apart from it being transparent?
The best benefit is if you are just traveling somewhere. Okay. You don't need to have the time to
visit,
to have a visit or to have the follow-up.
Okay.
So you can have number of aligners, because it's all computerized system. It's all technology based.
Wow.
So you have a set of aligners with you, and you can change it fortnightly after 2 weeks.
The patient himself?
Yeah, himself.
Wow.
Because he's sometimes there might be other procedure associated with it that is being done by the dentist. Otherwise, if it is as far as mine experience is concerned, I always prefer to go for the plastic braces in the mild to moderate cases, where I don't need to have a lot of checkups and everything. So if the patient is leaving, or if he or she is going abroad, so then we can also have this braces for them. This is one of the, like a blessing for them.
Right.
So now the conventional, we always ask the patient to come after 4 to 6 weeks. But in this, the patient himself changes to another aligner fortnightly after 2 weeks.
Okay.
They claim to be, that is the speed up.
Okay. What are the most common duration? I think you answered some of this, but maybe you would like to expound further. Duration of the orthodontic treatment. So, as you mentioned already, it's dependent on the frequency of the visit of the patients and how do you call it? How religious the person is in. What is the minimum time gap? Like, is it you mentioned 2 weeks?
No. Yeah. As far as the Invisalign or the clear aligners are concerned, they claim to have to change to another aligner 2 weeks fortnightly.
Right.
But as far as the conventional braces are concerned, we always call upon the patient after 4 to 6 weeks, after 1 month.
That's long.
After 1 month, because we need to have a heal-up process.
Right.
Because when the teeth move to the new position, so there should be a healing process as well. So we cannot short-circuit the healing process before that period.
Okay. Another question is, would you say that because there is a little bit of restriction due to corona, due to the pandemic, that this prompts the patients to visit the clinic less and uses this as it's a valid excuse, right? So do you have cases like that where patients are more, doctor, can you just adjust this to make sure that I don't come back for the next 4 or 5 weeks because it's such a hassle? Because of the restrictions going on in the country. Yeah, but
we have a normal routine of calling upon the patient after 4 to 5 weeks. So in between, if they have any problem, they can always come. They are always most welcome. So this is the normal protocol. We always call upon the patient after 1 month.
Okay.
This is our normal protocol.
That was very informative, and I think if there are any questions from our viewers or our listeners, please do send it in. This is a question from, can you please? What if there's someone from Mr. Toby Harris sent in a question. What if there's continuous gum bleeding? What may be the problem?
Okay. So it depends. It's basically multifactorial. But one of the most common causes is basically the oral hygiene. If you don't have the good oral hygiene, and there is a plaque formation and the calculus formation is there, so the gum gets swollen. So it's easily then it gets bleeding. So
and I think I think, doctor, correct me if I'm wrong as well, no? It may or may not be related to having braces, right? I mean, gum problems or gum bleeding.
Yeah. Coming again to this is all depend on the oral hygiene. If you have braces, you will have a little bit difficulty in cleaning the teeth properly. But I have seen so many patients, they are very good patients and they have a very good oral hygiene, so they don't even bother if they have braces or not. Really? But some patients, they do not brush the teeth properly. So this is one of the most common reasons. This is one of the most common reasons. And they just do it. If you ask them, they will always tell you that they are doing brushing 2 times a day or 3 times a day. But when the second question you ask them, what duration do you do the brushing? They will say 1 minute. It's not enough. You have to reach the brush everywhere, every corner of the tooth.
Especially that you have equipment there.
Yeah, equipment there. And then, basically, you need to have at least 4 to 5 minutes brushing before going to bed. That is most important. And after the breakfast, 5 minutes at least. And you have to reach the brush everywhere and do it properly. You can watch the YouTube videos. There are a lot of YouTube videos how to brush the teeth and how to brush the teeth with the braces even.
Doctor, I have a question. Doctor, do you have special toothbrush that you recommend for anyone who's having the traditional or the Invisalign braces?
Invisalign, it is the normal because whenever you brush the teeth, you will have to remove the aligner. Okay. Before eating and before brushing, you will have to remove the aligner. And after the eating and after the brushing, you will have to wear it again. So there is no special brush. You don't need to that. As far as the conventional braces are concerned, we have a special orthodontic brush. We have a special orthodontic brush that is basically designed for the braces
to go through
in order to
each nook and cranny.
So just to get rid of all the food stuff that impacted there.
Okay. Are there more questions from our listeners and the people who are watching on Facebook? Actually, I have a lot of questions because I was really curious when you mentioned about the age of the children. And I think now it kind of makes sense because I have a 7-year-old, and when you mentioned that it's all because of the jaw of the parent and it's hereditary. I thought I have to wait a little bit longer for him to be assessed whether, because it looks like he will require braces. He inherited that part from me. So I realized, I said, maybe I'll have to wait, but no, it doesn't look like that. There are actually methods that you mentioned about the face. Is it, what do you call it again, doctor?
That is face mask therapy.
Yes.
That is for if the upper jaw is basically deficient. But this is one of the discrepancy I just mentioned. It's not necessarily, but for that type of discrepancy, you need that face mask therapy, and you can start the treatment as early as 7 years.
Yes, exactly.
But as far as the other jaw growth modifications are concerned, you can start it in the female. The growth ends a little bit ahead of the boys, because it has to be stuck around the circumpubertal growth spurt. Circumpubertal growth, when the girl reaches puberty,
it will again shift, you mean?
Yeah, so that is the reason, because the growth finishes almost to the slower part in the females around 9 to 11 years. And the boys are the late skeletal developers, so they can have the good leverage from 12 years to 15 years. You can start the growth modification process there around 12 to years. But as far as this one is concerned, the females are concerned, so you cannot have this one.
So you say, doctor, if for example a child comes to you at 7 years old and then you introduce this treatment of the face mask, what is the probability that the whatever change will be effect to the child will be cascaded up when he grows older? Is there a likelihood that it will still change, or it will just kind of improve it and then later on he will still probably will require braces?
There are a few things. once you are done with the correction, then you have to retain it.
Yes,
You
maintenance.
will have to retain it. So we always give the patient retainer. That is called in Arabic mutabbit. So retainer has to be worn till the
Right.
growth ends.
Okay.
Like in some cases, we do give them till the 17, 18 years of age.
Wow.
Once the growth has been shifted to the decelerated stage, then you can taper it off. You can taper off the this retainer. But if you just remove after the correction, it has
will go
always
back.
the tendency to relapse, to go back to its original position. So that is the reason we always prefer and we always advise the patient to wear retainer as religiously as the braces.
Right. I think you almost answered our last question, but before that, again, we have another listener, or maybe probably watching our Facebook Live, from Athena Kaliwara. Doc, how about the wisdom tooth? Is it necessary to have it removed?
Yeah. So the wisdom tooth, basically, if you see, this is nowadays it's a third molar. If it is not going to give you any problem,
Or discomfort?
yeah, discomfort, so it should be better be there. But if it is going to injure your adjacent tooth, and if it is going to give you any problem or any discomfort or pain, then it's better to get it removed.
Okay. Last question before we end this episode of The Doctor Is In. What is the importance? I think you already explained this, the importance of the retainers. And then also, Doctor, I have another question. Will the wearing of these appliances be lifetime? So, for example, you went through treatment, right? You had the braces, and then of course, you have to wear the retainers. Until when? So, for example, I'm 18 years old. I had the braces a year, and then after how many years? Is there like a specific time frame that you follow that the next 5 years you have to wear it? You know.
Actually, it depends on the severity of your problem and the type of tooth movement that has been occurred. So in some cases, the retainer has to be worn for at least 1 year because the tissue needs to get accommodated to the new position of the teeth.
Right.
So the tissue needs that much time. There are some fibers that need some time, and it is around 1 year. But in some cases, the tooth movement that has been notoriously relapsible. So you will have to wear it for the indefinite period time, like 5 years, 8 years, 9
Really?
years, 10 years. And if it does not give you any discomfort, it has to be there. The rule of thumb is the longer you wear the retainer, the longer it gets retained. So this is the rule of thumb.
Yes. Okay. Yeah. Thank you very much, Doctor. I think we've had a lot of inputs from you. Very informative as well, discussing orthodontic treatment and the new solutions available in Qatar and of course in Alrabeeh Dental Clinic. Any parting words, Doctor, to our Qabayan radio listeners? Do you want to say anything? Of course, we will promote that the services of Alrabeeh are top notch and up to date as far as technology is concerned. Yeah. And I believe there is also your treatment offers at a very affordable price.
Yeah,
is that
we
right?
have a special discounted prices for your community.
Wow, really?
Qabayan, yeah, they can always visit us, and they can feel free whenever they want to come to have a checkup and to have a discussion regarding their problems. So they are most welcome, and they have this special discounted prices.
Right. I think it's 999 reals.
Yeah, you can start it from the 999.
That's the full treatment already, Doctor?
No, it is just a down payment.
Okay.
It's just you can start it from 999.
Okay. Yeah. Wow, amazing. Yeah, thank you very much. Do you have any other information, or would you like to say anything else to our listeners?
Yeah, I would like to urge all the parents to have at least one checkup of their kids,
right,
regarding their the jaw discrepancies or the teeth discrepancy. If there is, so they can be treated in time, and they can avoid the social stigma. So there are so many malocclusion, irregularity of the teeth that the kids get bullying at the school.
If I may share, yes, yeah, I have this experience when I was a kid. I remember, and I got the braces when I was 13 years old. But before that, you're right, Doctor. It's a social stigma. Yeah,
so that will bring good confidence among your children.
True. Yeah,
and also if there is any other problem associated with other things, so they can be checked there and then, and they can be treated in time.
The checkup, doctor, does it cost anything? I mean, for the initial checkup to just assess what sort of treatment will be.
There are very minimum charges for the consultation. So it's not a big deal.
And how many orthodontists do we have at Alrabeeh?
We have a lot of orthodontics in all of the centers, but as far as the new Alrabeeh Dental Centre is concerned, I'm the only orthodontist there.
Okay.
Yeah, I'm the only orthodontist there.
Okay.
So they are always most welcome whenever they want to see me, whenever they want to see other doctors.
So tomorrow, I think you will have a long list of appointments. Where do we call, doctor? Of course, we have to set up an appointment. Is there a general number that we can call or send an email, or how do we make appointments?
You can make, there is basically the number, I think there is a number of receptionists, and you can call them, and they will be always.
And of course, you have a
available to
website.
answer.
You have a website?
Of course, we
Of
have
course.
a website also.
Okay, thank you very much, Dr. Ali. We are very honored to have you here. Of course, we also would like to thank Nasim Alrabeeh Dental Clinic of Azizia, the new clinic, for allowing you to come in and share your insights and your knowledge and your experience, obviously, and your recommendation to all our Qabayan listeners.
Thank you so much.
Thank you.
So
I
much.
hope you enjoyed this very quick Doctor is In episode for our listeners.
It was also an honor for me to be here with you people.
Thank you, Doctor.
So much.
Thank you so much.
Bye.
We will be back for the regular programming of the after shift after this quick break. Good evening, everyone. You are still tuned in here on Qabayan Radio 94.3.